Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Presidential Task Force on COVID-19 briefs again as National Orientation Agency condemns disobedience to the COVID-19 prevention protocols across the country. World Health Organization considers methodology for coronavirus vaccine sharing as the race for production intensifies. And nearly 500 Russian doctors have died after contracting COVID-19. Nigeria has now tested over 100,000 people as it expands its testing capacities across states in the country. The latest epidemiological report on COVID-19 leaves figures at 17,735 after the Nigeria Center for Disease Control (NCDC) announced 587 new patients yesterday. The new cases were recorded in 17 states and the Federal Capital Territory. In 24 hours, 14 deaths were also recorded, putting the death toll at 496, while 5,967 people have recovered. The nation's total active cases now stands at 11,299. Let's show you a breakdown of regions, with Lagos in the southwest, the epicenter of the virus, with over 7,616 confirmed cases. It has discharged 1,323 and lost 107 people to the virus. The FCT is next in the north central, topping that region with 1,391 cases. It recorded 67 new infections from last night. Then there's Kano State, leading in the northwest with 1,160 cases. River State maintains its lead in the south-south with 696 cases, Borno in the northeast with 457 cases, while Abia State still leads in the southeast with 173 cases. The Presidential Task Force continued its briefing today, warning against gatherings, saying that Nigerians are more vulnerable to the COVID-19 infections more than ever before. The chairman of the COVID-19 Task Force and secretary to the government of the Federation says the greatest challenge to the fight is human resistance to treatment.
The greatest challenge are human resistance to change, stigmatization, mental health, skepticism, culture, religious belief, rising incidences of domestic violence, and a host of others. Ladies and gentlemen, the COVID-19 has changed our ways of life, and we may never go back to what we used to know. As we push the frontiers of research at domestic and international levels, the debate on which drugs will be clinically suitable also continues. With our reliance on data and science, we eagerly look towards crossing the threshold of experiments into a wall of cure. We continue to encourage our researchers and scientists to rise up to the occasion by submitting to the validation processes. The Presidential Task Force position is that every treatment regime must be supported by incontrovertible evidence of science and processes. The Presidential Task Force wishes to express its appreciation to our diverse stakeholders for their support and commitment to the cause of humanity. This includes the health workers, who we used to know as our frontliners, but as from last week are now our last line of defense.
Corroborating Mr. Mustafa, the Minister of Health, Dr. Osage Hanire, warns that the coronavirus is killing people daily, and as he put it, not even the high and mighty are spared, and so there's no reason for anyone to expose him or herself to the risk of contracting the virus.
I must emphasize that going to places where there can be a crowd, like a market, or also places of sports, places of entertainment, or places of worship, carries risk of increased exposure because you do not know who is standing next to you or who is standing in front of you or behind you. The novel coronavirus is still among us and is infecting people daily, including even prominent members of society, and many of them surprised and not knowing exactly how this infection came about. Till it goes away, whenever that is, we must take extreme precaution when going to public places. Our treatment centers will also be getting an advisory to test the applicability of a drug recently repurposed and announced as being effective for treatment of COVID-19. The Ministry of Health will also be prioritizing the procurement of oxygen generators alongside ventilators, because our experience so far shows that oxygen supplementation is in high demand and very helpful in treatment of COVID-19.
The PTF National Coordinator puts it directly when he says that unless people heed to the warnings, the nation should expect more cases.
Thank you very much.
COVID-19 is far from over globally, and neither is it over in Nigeria. There's no doubt that a lot of community transmission is happening, and it continues to increase across the states. Now, more than ever before, if you go out, you are more likely to get COVID than before. Your risk of acquiring COVID because of the numbers we have now is more than 3-4 weeks or 5 weeks ago when we had a lockdown. So there really isn't any room for relaxation at this point. The reason why we had to relax the lockdown was in order to sustain the livelihoods of Nigerians, particularly those who depend on a daily income for survival, as well as to sustain our economy. But it wasn't because COVID has gone, and it wasn't because we should be more relaxed in terms of our prevention measures.
Even though vaccines are yet to be developed for COVID-19, the World Health Organization is already thinking of a sharing formula for member nations once the COVID-19 vaccines are out. The World Health Body's chief scientist, Soumya Samnathan in Geneva, says there is high consideration for the more vulnerable countries instead of targeting only countries that can pay for the vaccines.
So WHO is working on a fair allocation mechanism, which we're discussing with our member states to see, can countries all come to an agreement on how you share a limited supply of vaccine? Let's say you have 50 or 100 million doses at the end of this year. Okay, how should the world share that? Should it go only to the countries which have paid for it or are capable of paying for it to cover their own populations? Or should it go to protect frontline health workers or the most vulnerable people, whether they are the elderly or whether they are people with other diseases? So this is something I think the global community needs to discuss, and member states will be discussing this at the WHO meetings that we have every week with them, and hopefully will come to support a framework that's fair, that's equitable.
To Akwa Ibom, where the chapter of the Joint Health Sector Union, JHESU, has issued a 15-day ultimatum to Governor Udom Emmanuel to reinstate 720 local government staff, majority of whom are health workers, whose appointments were terminated last year by the state government. This formed part of the union's demands contained in a statement jointly signed by the state chapter of the National Association of Nigerian Nurses and Midwives. The union has condemned what it described as government's insensitivity to the plight of the health workers. Now, joining us from our Abuja studio is Dr. Nasiya Waziri, an epidemiologist and national coordinator, National Stop Transmission of Polio, Africa Field Epidemiology Network, AfriNet. Dr. Waziri, welcome to the program.
Thank you for having me. Good evening.
Good evening. Now, test, detect, trace, isolate, and treat. How fast are we moving?
Yeah, so I think Nigeria has done pretty well over the few months that we've had the COVID-19 outbreak. We've been able to increase our testing rate. Right now, we are at about 520 tests per million, recognizing the fact that other countries have done way more than us. Even countries like Ghana has done 20 times more than what Nigeria has done. South Africa has done about 30 tests more than what Nigeria has done. But I think we have really moved fast, and we've increased our testing rate. And without testing, we cannot detect. So by increasing the testing rate, we've increased our detection rate. We've also been able to move fast with listing contacts and following them up, but importantly, getting confirmed cases into isolation and treatment centers. So Nigeria has fared very well over the couple of months that we've had this outbreak with us.
Dr. Waziri, the Presidential Task Force has said that there is a challenge, and the greatest challenge is human resistance to change. They're seeing a lot of stigma. They're seeing a lot of people not obeying the prevention guidelines. What do you think we need to do to change strategies to overcome this?
I think there's a lot that we need to do on individual level. COVID-19 is real. On our own level, I think communication will do a lot to let people know that this disease is real, because there's a lot of denial about the disease in the community, and that is why adherence to the recommended guidelines is difficult. So on our own level, on the community level, we need to educate ourselves, we need to educate our neighbors, we need to educate individuals that COVID-19 is real. It's here with us. Without adhering to guidelines of social distancing, the using of masks and the hand hygiene and the respiratory hygiene, those non-pharmaceutical interventions, we will not be able to deal with the transmission of COVID-19. So there's a lot that we need to do on social mobilization and community engagement, but even us as members of the community, we need to educate our communities.
Now, Nigeria, to a large extent, has eradicated polio, but are there fears that there might be a resurgence, seeing as even our agencies, the Ministry of Health has reported a lower number of patients visiting hospitals, considering the pandemic we're fighting?
Yes, we've had a decrease in number of people going to the hospitals. We've had a decrease in number of caregivers and parents accessing immunization for their children. But the government has also tried to address this by doing a lot of engagement, a lot of capacity building at the lowest level, trying to bring the primary health care centers up to board with how to render services within the COVID-19 pandemic, how to be able to also detect and to raise their level of suspicion for the disease in case they encounter that, because the fear is really both sides, from the healthcare workers, but from also the parents and the caregivers seeking care and seeking preventive services. So the federal government, through the National Primary Healthcare Development Agency, has done a lot of capacity building, a lot of sensitization on that, and it's been concluded, I think, this week in a lot of states, and the sensitization, the training starts from the state level down to the community level, where community informants, community influencers are being engaged to be able to educate the community on COVID-19, but also to get parents and caregivers to allay their fears and get them to get to the health facility if they need to seek care or if they need to seek preventive services.
All
so
right,
the fear of the resurgence, it's a bit pretty low now.
All right, we appreciate your time. We hope to have you on again. Thank you so much, Dr. Nasiya Waziri, epidemiologist. Thank you for joining us on the program.
Thank you for having me. Thank you.
Still to come on our COVID-19 update, Kaduna State Governor is threatening another lockdown over community transmission of COVID-19. That's in a moment. The National Orientation Agency, NOA, says there is a persistent and remarkable disobedience to the COVID-19 prevention protocols across the country. The Director General of the agency, Mr. Garba Abari, stated this while presenting the second report of the agency's observation on its COVID-19 sensitization activities in the country. According to him, majority of Nigerians no longer use a face mask or maintain physical distancing.
Nigerians are showing persistent and remarkable disobedience to COVID-19 prevention protocols. In the cities where adherence to these protocols was high in the initial 2 weeks of the of the lockdown, citizens are letting down their guards, and this is of grave concern. Now many Nigerians only use face masks to avoid security agencies, or if the place they are going to will enforce the masking policy. With the opening of religious centers, many religious centers, especially in the cities, are complying with the protocols on worship gatherings. However, there are still some of them whose compliance level are less than commendable. Efforts must be geared towards enforcing the protocols in places of worship.
Over in Kaduna, residents there may have to brace for another round of lockdown in the face of rising cases of COVID-19 in the state. Governor Nasser El-Rufai said this in the state while commissioning a mobile testing laboratory for community testing of COVID-19 cases. According to him, carefree attitude of people about the dangers of the pandemic could worsen the situation. Well, let's take you to our guest who is joining us from the UK via Skype, Dr. Estianu Kurabi, GP Registrar, Accident and Emergency, Royal Hospital in the United Kingdom. Glad to see you again. Thank you for joining us.
Thank you very much.
Dr. Kurabi, tell us about the front lines in the UK. It seems a lot has happened in the past 1 month.
Yeah, a lot has changed really as regarding the coronavirus pandemic in the UK and particularly in the front line. So as we have seen the cases of coronavirus reduce as well as the deaths reduced in the UK, we've seen less and less number of persons attend the accident and emergency and having to go into the coronavirus ports. So we've seen the hospital admissions with query coronavirus disease reduced very significantly. And that's very good. We still see lots of temperatures, lots of cough and things like that. But the ones that have come back as positive for coronavirus has drastically reduced. And that shows that the rate of transmission in the community has stayed low. So the government has announced that the R rate, which is the rate of transmission, is still less than 1. And that has reflected in what we are seeing in the front line in accident and emergency.
Now, the news on dexamethasone drug seemed to have good reviews. How significant is this breakthrough?
It is very significant and it's a good news for medical care all around the world, because dexamethasone is not a new drug, as it were. It's been available since the 1960s. So the mode of action is already known, the side effects is already known, and the efficacy in terms of the anti-inflammatory effects of this drug has already been tested and proven. And I mean, from the results gotten by University of Oxford, where the research took place, it showed a remarkable improvement in the patients that were, tried with dexamethasone. So it showed a significant reduction in mortality on patients on ventilators and patients on oxygen. And it reduces the likelihood of those patients to die from coronavirus. So 1 in 8 patients are prevented from dying if they are on ventilators and they are placed on dexamethasone for 10 days. And I mean, to me, that's an improvement. That's the first drug that has been shown to reduce the mortality of coronavirus. That's a step in the right direction, I would say.
And perhaps finally, to get your thoughts as to our national response here in Nigeria to curbing COVID-19, seeing as the last time we spoke to you, we hadn't done a lot of tests, but now we're doing over 100,000. What do you think of our strategies so far?
I think Nigeria is making progress, but I would say the progress is, still really slow. Good enough, we've done 100,000 population of 200 million. I don't want to say what percentage that is, but a lot more can still be done. And there are some states that have not recorded a single case in Nigeria, but yet they've tested barely 100 persons, states like Cross River State. And for me, that's not a good demography as regarding this pandemic. I think more testing needs to be done, like I've always said. And to round up, at this state in Nigeria, the resident doctors are striking. So I think that the healthcare system is in a very, very dire state at the moment. So the government needs to wake up, sort the doctors out, increase testing, and put the health sector right again.
Always a pleasure. Thank you so much, Dr. Esen Ikorobi, GP Registrar, Accident and Emergency Hospital. Thank you for joining us.
Thank you, Millicent.
Today, Russia's health watchdog said there had been a huge rise in the number of medics who had died. The statement appeared to be based on a list of deaths compiled by an independent website, which put the death toll at 489, up from the official figure of 101 on the 26th of May. We have more on the coronavirus cases across the world.
Spain has announced a €4.25 billion plan to assist the crucial tourism sector's recovery after being hit hard by COVID-19. International tourism has been closed in Spain since March 14th. So far, the coronavirus has killed over 27,000 people in the country, with 244,683 total cases to date. Over in Russia, nearly 500 doctors have died after contracting the coronavirus. These numbers are a sharp increase from last month's toll of 101. The increase has been attributed to issues supplying protective medical equipment. Russia currently records more than 561,000 cases, including 7,790 new cases in the past 24 hours, making it the third highest cases per country. The death toll stands at 7,760. In Scotland, Prime Minister Nicola Sturgeon has announced that all shops, excluding those in indoor shopping centres, will be allowed to reopen from June 29. Dentists will be able to open up and contact sports are allowed to resume, despite face coverings will be mandatory on all public transport. This is all a part of Scotland's move into phase 2 of easing of their lockdown. Moving to Asia, Japanese Prime Minister Shinzo Abe says the country will ease entry restrictions for travelers coming from Australia, New Zealand, Thailand and Vietnam in an effort to restore people's livelihood. Japan currently has 17,588 cases with a death toll of 935.
Wear a mask on your face, not your chin, as it has no value under your chin. The PTF says that face masks are to be used as an additional layer of physical distancing while out. You can find the latest guide on the NTDC website, as the centre continues to work closely with states, training health workers to manage COVID-19 patients to recovery. Also, the World Health Organization has the latest updates on the global response to the COVID-19 strategy. Their website guides the public health response at all levels, including practical guidance for strategic action. ChannelsTV.com, our website, has more updates. You can find the latest on the pandemic in Nigeria and across the world. You can see there how Nigeria can limit COVID-19 death rate from the health minister. Lots of stories all at your fingertips. That's ChannelsTV.com. That's our COVID-19 update. Thank you for watching. I'm Millicent Walker. Stay healthy, stay safe.
Stay connected to the world with Channels TV Podcast. and get all the trending stories. Simply log on to channelstv.com, click on podcast, select the program of your choice, and listen. Our podcast is available on Apple, Google, and Spotify. Tap the expertise you trust. Touch the stories that touch you. Anytime, anywhere.